Hi everyone, welcome to Camille's Holistic Health Show. I'm Dr. Cam, and today we are going to talk about longevity and your ability to fight aging and living a longer and a more abundant life. If this is a video that you are interested, go ahead and subscribe to my YouTube channel, hit that bell, and get notified every time I have a new video coming out because I put them out often with women's health and holistic living. So let's begin, let's dive in. And since the 19th century, commonly longevity has been shown to be a very important aspect of our health and wellness. At one time, the average male expectancy of living on the earth was mid-40s. Could you believe it? And for females, expected life was until late 40s. So we've come a very long way. Experts found that people were living beyond 70s and 80s. And in recent times, men are expected to live over 80 and women are expected to live past 90. So we've come a very long way from, barely living in your mid 40s and having health conditions or even dying very young from, accidents, injuries, things like that, to now being able to live a lot longer. And if this is really something that you are interested in, then holistic medicine, holistic lifestyle can really add that to your life. So rarely do you see someone who has lived past 100 years old. And that's true. And according to experts, a person living past 125 years of age is the same odds of a needle in a haystack. So, we can get to as far as we can in life by doing the necessary or taking the necessary steps. We have to work at it, but that's okay if you are willing to work, put in the work to get yourself where you need to be to live a little longer. That's what anti-aging or longevity is, and being able to, sustain life and with preventative health. So most people can, live past 90, provided that they have a quality of life, whether they have a good medical care, whether they have good hereditary makeup. That's definitely part of living longer, as we know. Many illnesses today emerge from poor eating habits. That is something standard diet, American diet, is not up to par. And, bad habits and excessive, drinking or having smoking, things like that can definitely lower our longevity or expectancy, okay, of living longer. Exercise, lack of it, and poor sleeping habits or stress. These all are part of living longer. So according to experts, genetic makeup is responsible for Alzheimer's, let's say, for example, heart disease. We can go on, diabetes, diabetes type 1. Diabetes type 2 is really your lifestyle and how the things that you eat, consume, and related to stress and related to sleep. So, and weight gain as well. So, it's just about understanding, having knowledge. Knowledge is key. I always tell my clients that knowledge is powerful. What you can do with that, you can actually, take these different tools, use them to your benefit. So genetic influences, um, definitely something for someone to understand based on their family history. The risk of are higher based on the genetic predisposition, and related to similar diseases as well. So just something to understand and know and be able to assess, and then formulate something to create a lifestyle so you can have, a more abundant life and live, uh, you know, a longer expectancy. So doctors review family history to search for, genetic factors that may show short or long expectancy. If you have, let's say, a history of diabetes, your doctor will take action to reduce your risk, yet it may not help stop the disease. So basically, it's about, if you get a diagnosis, sometimes conventional medicine, it stops right there. Medications, things that you do is just pretty much you go to your doctor, you get your medication. But remember, there are many other things that you can incorporate into your lifestyle so you can live a, a longer life expectancy. You know, stopping certain foods, getting more active, having more, eating, smoking less, drinking less alcohol, and focusing on the reduction of stress in your life. This is really, really important. The stress can really, it's really change the course of your life. So remember all these things that can really make a transition. It's important to make that transition in your health. And believe me, there are more things that you can do, more actions that you can take, rather than just going to your doctor and accepting the medications and just popping it that way and having to deal with other uh, suppressive conditions that might happen at a later date. So doctors will also consider factors like environment, because that is something that we are, compounded with on a day-to-day basis. Exposure to toxins. A lot of people believe in it, some don't. But pollution is toxic. I believe that. The different pesticides and herbicides out there, I believe many people do too, that it is harmful to our body. So consider things like organic foods, consider things that will reduce your exposure of toxins in your body, things that would help with reducing toxins in, let's say, the foods that you eat, and also the water, drinking your water with a more purified filter, just to name a few. Laundry detergents that are organic and pure, you might want to look into that. And detergents like dishwasher detergents, and to wash your wares with, consider ones that have less toxins in it. So if you have a history of visiting your doctor often, then you will have a better chance of improving your health, because you are proactive, and going to an alternative practitioner or somebody who is in preventative medicine is also something to consider, because they will help you with your eating habits, your daily lifestyle, and incorporating all of that to have, give you that chance of having an increased longevity. So, did you know that some types, not all, cancers are curable, provided that it's spotted early. Some of us know that. Some of us have to really absorb that and really understand it, because it's something that we don't think about. Alzheimer's disease, it's really curable if it's caught at an early stage. And other diseases are more curable, especially if it's caught at an early stage as well. So, since the 19th century, medical experts have come a very, very long way when it comes to improving and preventing, diseases and giving us a fighting chance to live longer. So, the experts continue to find ways to really help live a longer expected life. And this is what I love. I always tell my clients and my holistic medicine patients that it's really essential to get on a lifestyle journey, because a journey might sound like a very long trek down a road, but really it's about investing in yourself and really owning your truth when it comes to, I am going to, standing with conviction that I'm going to do this, I'm going to stick to it, because commitment and having the accountability, whether you have it or have not, it's important to have that accountability in yourself. So it's getting deep within and really, having the ability to take your health to the next step, the next level. So our glands produce hormones and they're released in the bloodstream. This is really the endocrine system. But however, when you get older, these hormones kind of slow down, right? We know this. To correct the slowness of your hormones, people tend to go to replacement therapy. It could be good, it could be bad. It's been shown, some say that it's been shown to have, problems with your health. I have to be careful what I say, but our body produces two major hormones, and that's estrogen and testosterone. Okay, our body releases these. For men, they release more testosterone, but they also have estrogen. Women produce more estrogen, less testosterone. But we both, as males and females, have these hormones. So testosterone is what makes men, seem or feel younger. And when they're older, they release it less. They gain weight. They their sex drive is decreased. So a lot of things are related to testosterone and the reduction of it as you get older. So in reverse, estrogen is one of the major hormones for females. Lots of things go on with estrogen, and the younger you are, the more you're able to produce that and be able to have children, and etc., etc. So as we age, the estrogen, is reduced, and there's a risk of disease, heart disease, Alzheimer's, osteoporosis. This has been shown in research, but estrogen therapy reduces the risk. However, research has said, or it's in the books, that side effects can lead to certain cancers. So it's the thing about estrogen and testosterone, all these hormones, it's a yin and a yang. It goes high, goes low. You get different symptoms. You feel good today, tomorrow you feel like hell. It's It's about living a life the best way we know how to, and giving yourself the opportunity to live, longer, healthier, but living well, because who wants to live long but feel like hell? So, it's about the balance and being able to sustain that. Okay. So, like all other supplements or treatments over the counter, um, one must consult with a physician before taking treatments, of course. Always important to consult with your doctor about anything that you want to take, anything you are taking. It's important for them to know. Don't hide that. Even if it's, I don't know, a tincture, a homeopathic remedy, really important for your doctor to be on board with everything that you're doing, because they're the best support that you have, and they want the very best for you. So, you know, sleeping, this is something that, we are affected with as life, uh, as we age. Melatonin is a major hormone for sleep. It is decreased over time as we age, because that's just how it is. We slow down in every aspect of our life when we get older. Everything just functions slower. And the hormone melatonin is from 8 to 5 is when this hormone is really produced the most. By taking melatonin supplements, some people do this, it can really help uh, with improvement of sleep. But there are so many other things that you can do to improve sleep. So don't forget, melatonin is definitely important. It's definitely something that you can consider. But remember, it can constrict your blood vessels. So knowing this, you'll have to be much careful with it and be able to know that if you have, for example, cardiovascular problems or high blood pressure, you'd want to definitely consult your doctor before taking such things. So important to know that hormones like that can, a reduction in it can affect your hormones. Also, for women, as we age, progesterone is reduced, and it can also affect your sleep if it's a little too low. So, things to consider when you want to live a more abundant, increase longevity, and fight aging. So when our body functions are interrupted, it affects our body and our mind on a whole, right? It determines how fast we age. So, when you've ever noticed that, one year you're well, someone, for example, would be well, and the next year they're deteriorating in what seems like um, weight, unable to walk properly, unable to function at a cognitive level. It's reduced. So someone in their 70s and gradually going into their 80s, in one year they can really see that really that big change in their life. So it's really important to know and to consider different factors. Like I had mentioned, environmental factors, your doctor's medication, smoking, consuming tobacco, and a healthy lifestyle with just basically taking those breaks for yourself. A moment of silence for yourself can do so much. And being aware of your breath during the day, because we don't breathe. 99% of people don't breathe well. So considering all these things, you want to add them in based on what your belief system is, based on what you think that you can handle, uh, and incorporating along with sleep, uh, ways of sleeping, getting to bed early. Sleep is so, so essential for living longer and being able to sleep through the night without waking up and having to fall back to sleep. All these things important. Okay, so it is important to review normal aging versus abnormal aging. Basically what I had mentioned. So eating, having a daily fantastic lifestyle where you're incorporating foods that can actually have sustainable vitality for your cells, because papaya is definitely one of the foods to be able to consume, because it has high or loaded with antioxidants, minerals, vitamins, to help with longevity, especially with the skin, the skin elasticity, fine lines, wrinkles. But it's most important because it helps with vitamins, potassium, magnesium, phosphorus, vitamin B, and all the important vitamins, vitamin A, C, K, E, calcium. Okay, so foods can really be able to sustain a healthy lifestyle because it has all the vital, um, necessary, essential um, minerals and vitamins needed for our body to sustain good health. So, another one is blueberries. I try to eat this every day. It has, anthocyanin, and that is a blue color that is loaded with antioxidants, and it gives the blueberries the blue color that it has. And anything with blue or green or bright colors are really something that you want to eat and consume on a regular basis, because it's loaded with rich minerals and vitamins that your body will just love to eat up and absorb, and really give you all the energy through the day, and all the abundance that you want. Gives you better oxygen supply to your body and your blood. So, just things to consider. You want to also consider, things like spinach and all the greens, the leafy greens are packed with, again, antioxidants. It really helps with oxygenating and replenishing the entire body. So it's same thing, it's filled with iron, very important, magnesium, and all the vitamins, vitamin K, C, A, E, very high in vitamin C, the spinach, for example. And then it also helps with helping inflammation in the cells. So, I can go on with different foods like broccoli. Broccoli is a powerhouse for antioxidants and anti-inflammation. And, nuts and seeds. I mean, I can't talk about nuts and seeds. If you can eat at least some walnuts, some almonds through your day, this is going to give you the necessary resource or vitamins, vitamin E, to protect the skin. It also has omega-3 fatty acids. Okay, so pistachios helps with type 2 diabetes. Walnuts will help reduce the risk of heart disease. Almonds will help with the decline of cognitive disorders. So just things to consider. Avocado, it helps with many things. Again, all the vitamins, vitamin C, E, A, K, vitamin B, potassium, just wonderful. It's wonderful for your skin too because it helps promote smooth, supple skin and really blocking those toxins that can damage with the sun rays. So consider avocado, especially for weight. It's really good to slow down your metabolism if you have weight problems as well. So pomegranate, I try to drink that at least 2 or 3 times a week. It's loaded with vitamin C, helps with free radical damage, and reduces the level of inflammation in the body or the system. So again, has antioxidants. All of these foods I'm talking about are loaded with antioxidants. Okay, so sweet potato, again, vitamin C and vitamin E. So just to consider, these are simple steps, simple ways to really, take control of your health and your wellness, and take it to the next level, because we're getting older day by day, and by the time you hit 35, you want to be able to fight the inflammation, and live and increase your longevity if this is something that you desire. So taking all of this in consideration, you really want to own your health, own your life, to take a journey and live a more fulfilled, well sustained future. So I hope you enjoyed my video today. Don't forget to subscribe to my YouTube channel. If you have any questions, go ahead and leave them and I will get back to you. I also have a Facebook group for women who are looking to take their health to the next level. It is a holistic Facebook group to live a more abundant in their mental, emotional, physical, and spiritual well-being. So it's called the Holistic Sisterhood. I'm going to put a link at the bottom so you can join if you are wanting to, head in that direction. Thanks so much for listening, and I'll talk to you next time in the next video. Bye now.